The chairman of Novo Nordisk, the makers of Ozempic and Wegovy, that weight loss diabetes drug that the market has been really exploiting. Oh, it is going to be there because, again, the price of the drugs are ridiculous. It costs $5 to make the drug. And of course, Novo Nordisk is selling it to Americans for approximately $900+ for the Ozempic and over $1,300 for the Wegovy. Well, what's interesting is that, these companies charge much less in other countries. England is only paying approximately, I think, $59 or so for it, and Germany over just a little over $100 or something like that for the drugs. Now, Bernie is going to question these guys, but it's something systemic within our healthcare system why we are paying these prices. It has more to do with our politics being controlled by the medical industrial complex. And, Obamacare tried to mitigate some of this by giving people health insurance. But having our companies still pay these exorbitant prices do very little. So what I want you to do is I want you to listen to Bernie as what he has to say about this drug pricing. But more importantly, I want you to remember Donald Trump's statement about wanting to kill Obamacare but have nothing to replace it. He said he had concepts of plans. The interesting thing about it, though, is we wonder if those concepts of plans would also include curbing the power of the drug companies that continue to rip us off. Listen to Bernie, and then we'll take it on the other side.
Senators are set to grill the CEO behind the popular weight loss drugs Ozempic and Wegovy. The CEO of Novo Nordisk has faced months of criticism from lawmakers over the high cost of these drugs. According to Senator Bernie Sanders, who chairs the Help Committee, a month's supply of Ozempic, get this, it costs almost $1,000 in the U.S. compared to $59 in Germany. And Senator Sanders is joining us now. Senator, great to have you here with us. We have talked about this issue before. There is a huge demand for these drugs, but it'll be really hard to pay for them, right? When you question the Novo Nordisk CEO, what answers will you be after?
Well, we basically want to know why he is charging the American people 10 or 15 times more for the same exact product that he's charging people in Europe, Canada, and elsewhere. And I think basically, he may say it or not, the answer is he can do it in the United States because he can get away with it. Other countries have strong laws. They negotiate prices. In America, historically, until very recently, drug companies could charge us any price they want. And in the case of Ozempic and Wegovy, we're dealing with the need to deal with epidemics in diabetes and obesity, costing us lives, costing us a lot of suffering, and huge amounts of money treating these illnesses. So you have a good drug. They have got to make this drug affordable for the American people so that we can begin to deal in an effective way with diabetes and obesity.
Novo Nordisk argues the net price of Ozempic after discounts and rebates has actually declined 40% since this drug was approved in 2017. What do you make of that argument that the prices have come down and they could fall even more?
Well, first of all, what they're talking about is, in some cases, after rebates from PBMs, charging $600. Number two, if you are uninsured or underinsured and you go to your pharmacy, you're going to pay the list price, which is close to $1,000. Number three, if you are on insurance and you get this for a reasonable price, the reason your insurance prices are going to be very, very high. So people can pay a reasonable price for the drug, but they're paying it at the other end in terms of high insurance rates. Also, I would add, these guys want to see Medicaid cover the product. They want to see Medicare cover the product. The estimate is that we would literally bankrupt Medicare, raise premiums to an unaffordable rate if we in the United States had to pay the prices that Novo Nordisk wants.
Affordability, accessibility to healthcare. This has been a huge focus of your work. So I have to ask you about the comments we heard from Donald Trump at the debate saying he saved Obamacare. Here's what he said.
So just a yes or no, you still do not have a plan?
I have concepts of a plan. I'm not president right now. But if we come up with something, I would only change it if we come up with something that's better and less expensive. And there are concepts and options we have to do that. And you'll be hearing about it in the not too distant future.
So those comments, in addition to saying he saved Obamacare, what's your reaction to what he is saying?
It's really quite amazing. He has been in 3 political campaigns. He has been president for 4 years. We are in the midst of a very serious healthcare crisis. We spend twice as much per capita on healthcare as any other nation. 85 million Americans uninsured or underinsured. Our life expectancy is lower than many other countries. And after all of that time, he is working on a concept for a plan.
So here's the deal. Concept of a healthcare system. You know, what we really need to do is stop playing around and do what the rest of the world is doing. Having some sort of a guaranteed healthcare for all, universal healthcare system. We call it Medicare-for-all, but I don't care what you call it. We have to stop killing our citizens, and we have to start caring about our citizens more so than we care about an ideology. We are allowing an ideology to kill us. We're allowing corporations to take advantage of an ideology they've imposed on us to prevent us from seeking the best medical system possible. And that's a shame.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number 1, subscribe to our channel. And number 2, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.